Viewers, this is Dr. Ajay Kumar, welcoming all of you to my channel. Today I am going to talk about uh, osteoarthritis. Osteoarthritis is very common problem nowadays, particularly in the old age people. And in this lecture, we will discuss about what is osteoarthritis, and we will look into its causes, its manifestation, and its understanding under homeopathy. We'll also discuss about what diet should be taken in such cases, and how can we manage it uh, with homeopathy. Dear friends, osteoarthritis means inflammation of joints. Wherever there is inflammation of joints, the problem of arthritis is established. And in osteoarthritis particularly, we see that in most of the cases it affects the knee and hip, where there is a weight bearing joints. In weight bearing joints like hip or knee, as the people becomes older, there are certain physiological changes uh, in in the body system, in the joints, and thereafter the problem of osteoarthritis is developed. In osteoarthritis, uh, 60 to 70% cases come with knee pain. In knee has a structure where both lower bone of the leg and the upper bone, the femur and tibia, both joins together, and it is uh, there is these two bones are covered with a layer of cartilage, and between these two bones there is one layer of meniscus. These meniscus and the cartilage acts as a shock absorber. When you run, when you walk, they absorbs the shock, and you move freely. There is a liquid inside that provides mobility to it, and the whole structure is bounded by a capsule, and over it there is a synovial membrane, and thereafter the layer of muscles that bound these two bones together. So this is the structure of knee joint, and we see that as the age progresses, uh, the gap between these two joints reduces, and the layer of meniscus is reduced, and and it impacts on the cartilages. So cartilages starts uh, rubbing against one other another, and they this way they gets destroyed. And when the case is even more advanced, we find that there is a reduction in bones also. So this way the pathology develops in the knee joint. So in the initial phase, when the problem is starting, uh, you will feel only some sort of a stiffness or pain in the region of knee, uh, when you sit for a long time and you starts walking, or when you wake up in the morning and you starts walking, you will feel certain degree of stiffness or pain. So this is the beginning stage, and when it goes into a mid-range stage, you will feel that some sort of swelling is also developed, and in the later advanced stage, the imaging of the joint shows a lot of destruction in the bone, in the cartilages, and at that time you will feel a lot of articulation, you will feel a lot of burning on walking. So This way, the disease progress. This osteoarthritis, uh, uh, with this with this knee pain, uh, in the beginning you will feel that your pain is being ameliorated by rest or by hot application, warm application. uh, so at this stage, if you treat or if you take care, osteoarthritis cannot be developed further. It can be checked initially. Once it goes into the psychotic phase, when there is a lot of swelling and numbness of the knee, or there is a paralytic weakness, uh, still it is treatable, and it can be reversed, it can be managed well if it is treated properly. In advanced cases, when there is tissue destruction, a lot of changes have taken place, cartilages have been destroyed, meniscus has been destroyed, even the bones has been reduced. In such cases, there is permanent stiffness and tension in the region because the placement of the two bones has has changed its position. There is shortness in the gap, and at that time the tendons and ligaments become stretched, and at this time you will feel constant pain or and there is a lot of burning in this region. So at this time, it is the case becomes irreversible, and it can be managed only. However, there is a hope that in many of the cases where the it is suggested for knee transplantation, uh, there are chances that it can be managed whole life through homeopathy in such advanced cases also. When there is complete destruction and there is no chance of recovery, no chance of management, at that time the only choice is knee replacement, but it is only in very very extreme cases. In most of the cases, up to the mid age, up to the psychotic phase, the chances of recovery is very very prominent. So it is well said that treat early to prevent the further damage. So it in all such cases, the patient should take notice of the conditions of the knee or the condition of the joint like hip, and they should take earlier step for the treatment. In age, apart from the age, a lot of exertion, overuse of the joints is also a cause for it. Improper diet may further add uh, to the problem, and dehydration um, is further a cause. Genetics may be one important factor. So there are several factors that causes osteoarthritis, but the most prominent cause is the age, because what happens, there are certain nutrients that is supplied by certain cell in the joints of the knee. They are chondrites, and with the age they stop working to function, and they don't supply the essential nutrients that is necessary for the joint, and thereafter the problem uh, starts. So this is age related problem in most of the cases. How, however, they are treatable and they are manageable. So we can manage it through proper diet, through exercise, regular exercise. In diet, what uh, care should be taken? First of all, you should eat a lot of vitamin C. Vitamin C is easily consumable, and that's why it needs to be replaced very early, because it doesn't it is not stored in the body for long time. So vitamin C, and in where there is inflammatory condition, omega 3 fatty acids should be taken. There are several diets which are enriched with omega 3 fatty acids. You take rid of all these things, and you take those foods that are rich in vitamin C and omega 3 fatty acids. That will help you in managing osteoarthritis. Proper exercise, particularly the stretching exercise, and which make the joints movable and pliable, they are important, and they should be included in your workout, daily workout, that will help to manage osteoarthritis. Now we will discuss how homeopathy can help in osteoarthritis. Let's see it through some cases that will better uh, for your understanding. You can understand easily through the cases. Ideal. My first case is about a person who is about 55 years of age, and he has been suffering from osteoarthritis of the knee for 3 years. And when he came to me, I found that he had certain problem in walking. After walking, he had pain. The pain was of burning type. Many a times he had certain stiffness in the initial motion, which was ameliorated after continued motion. But he also told that sometimes he has burning when he walks along, uh, and he was very fond of sweets, and he was by nature he was very shy, timid, gentle kind of person, and on such basis, um, we made a X-ray report of the knee and found that there was no major tissue changes, and overall uh, his symptom and personality and the X-ray report pointed out that there was a psoric manifestation in the that was prominent in that case, and on the basis of symptom totality, Lycopodium was selected, and after treating with the Lycopodium with certain food supplements, the person was okay. After 6 months, he started getting benefit from 2 to 3 months, and after 6 months or 8 months of treatment, particularly 8 months of treatment, he was completely free from osteoarthritic pain of the knee. In a second case, when he was a car driver, and he came to me with the uh, left knee pain, and in that case, I found that because of the long driving, he had to use his leg for clutches, and that's why he had pain. So there, in this case, there was a overuse of knee, and uh, in this case, only Rhus as per modality was suggested, and he was asked not to drive, or if he want to drive automatic car, and he shifted to automatic car, and thereafter his knee pain was completely vanished. He got complete cure. So, person to person, case to case, we differ in homeopathic treatment, and that is the beauty of homeopathy, that each case is different. In each case, we have to individualize the patient. In another case, we talk about a case of a lady who is very bulky type of lady, and he had been suffering from osteoarthritic problem of the knee for long time. So actually, his whole body was paining, and leg, particularly the leg, the left leg was very painful. There was It was so much painful that when he entered into my chamber, she was not walking properly. She was a bit walking like a lame person, and so long she was sitting in front of me, she was always pressing her leg. She was very restless with the pain, and the pain was of long standing. There was a lot of endocrinal um, symptoms, endocrine problems she was suffering from since delivery. And uh, and uh, one particular thing that I noted in that case, that the pain was of burning type of pain. The pain was aggravated at night. There was lot of restlessness with the pain. The pain was very very of sore type. There was lot of soreness. And a very peculiar thing which I found in that case was the lady was neither able to walk long, and nor she was able to sit for long time. So initial motion in that case, what was happening, that when she started to walk there was a lot of pain, and the pain was ameliorated after some time, after some distance covered, but she was not able to walk throughout. So the pain reappeared after a few minutes. When she started to walk, there is a pain, there is amelioration thereafter, but she cannot walk for long because the pain reappears. So in this, apart from this, we also found in this case that the lady had a lot of heaviness in the breast, and there was a cyst type of feeling in her breast. So in this case, the overall uh, symptomatology of the osteoarthritis was indicating for syphilitic type of osteoarthritis. And in this case, as per her symptoms, Phytolacca was selected, and with the Phytolacca, the lady got a lot of relief. So, dear friends, osteoarthritis can be managed under homeopathy. It depends upon at which stage you are getting under treatment, and the better it is better to come early, because the cases are reversible in the initial stage, or till the mid stage. So homeopathy promises a lot in osteoarthritic cases. There are a lot of medicine. It is futile to talk about the medicine because each medicine has a lot of symptoms, and there is no specific medicine for knee pain. So homeopathy works only when the medicine matches your symptoms. So it is advisable for you to get treatment under a qualified doctor, so that he can understand your uh, disease in completeness and can give you suitable medicine. uh, if you feel that this lecture has benefited you, and you like this lecture, please do share, do comment, and do subscribe my channel. Thank you very much for watching it.